Question 1. A 32-year-old with suspected cholera arrives with BP 74 over 40 millimeters of mercury, HR 136, mottled skin, and no urine output for 6 hours. What is the nurse's first intervention? A. Draw labs for electrolytes and cultures. B. Administer IV ringers lactate bolus via 2 large bore iversis. C. Insert Foley catheter to measure urine output. D. Prepare to administer IV doxycycline. Answer. B. Administer IV ringers lactate bolus via 2 large bore IVs. Rationale. This is hypovolemic shock requiring immediate rapid isotonic resuscitation with LR, preferred for cholera. Labs and catheter are important but secondary. Antibiotics come after stabilization. Question 2. A 6-year-old with severe cholera is receiving IV fluids. The child suddenly develops crackles, respiratory distress, and rising jugular venous pressure. What should the nurse do next? A. Stop fluids immediately and administer diuretic. B. Reduce infusion rate and notify provider. C. Continue rapid fluids until urine output increases. D. Switch to hypotonic solution. Answer. B. Reduce infusion rate and notify provider. Rationale. Fluid overload must be recognized early in rehydration. Reducing rate while maintaining some hydration prevents shock rebound. Stopping completely risks hypovolemia. Hypotonic fluids are dangerous. Continuing rapid fluids worsens overload. Question 3. A nurse suspects cholera in a rural area with limited resources. Which action has the highest priority for community protection? A. Collect stool samples for lab confirmation. B. Immediately begin ORS distribution to affected households. C. Hold mass education until lab results confirm outbreak. D. Report only if mortality is observed. Answer. B. Immediately begin ORS distribution to affected households. Rationale. In outbreaks, rapid response with ORS distribution saves lives before confirmation. Lab samples support surveillance, but are not priority. Waiting for confirmation delays life-saving intervention. Question 4. A 28-year-old client with cholera is receiving 4 liters of IV fluids over 4 hours. Serum sodium rises to 160 milliequivalent per liter. What is the best nursing action? A. Switch to hypotonic saline infusion. B. Continue current therapy and recheck sodium later. C. Stop fluids completely until sodium decreases. D. Increase antibiotic therapy to control stool losses. Answer. A. Switch to hypotonic saline infusion. Rationale. Hypernatremia from rapid fluid resuscitation requires hypotonic correction to prevent neurologic injury. Stopping fluids risks hypovolemia. Waiting worsens sodium elevation. Antibiotics don't correct sodium imbalance. Question 5. A nurse evaluates a patient with cholera who has received 6 liters of fluid replacement. Which parameter best confirms adequate tissue perfusion? A. Capillary refill less than 2 seconds and MAP greater than or equal to 65 millimeters of mercury. B. Resolution of diarrhea frequency. C. Absence of skin tenting. D. Stable weight compared to admission. Answer. A. Capillary refill less than 2 seconds and MAP greater than or equal to 65 millimeters of mercury. Rationale. Tissue perfusion is measured by hemodynamic stability and circulation. Stool frequency is not an indicator of perfusion. Skin tenting is subjective. Weight lags behind clinical status. Question 6. A patient with cholera and severe dehydration develops muscle cramps, flat T waves, and ileus. Which intervention is most critical? A. Administer IV potassium chloride with fluids. B. Restrict fluids until potassium normalizes. C. Give oral rehydration only. D. Administer calcium gluconate IV. Answer. A. Administer IV potassium chloride with fluids. Rationale. These are classic hypokalemia signs. Potassium replacement is life-saving. Restricting fluids worsens dehydration. ORS alone is insufficient for severe hypokalemia. Calcium gluconate treats hyperkalemia, not hypokalemia. Question 7. A cholera patient receiving rapid IV fluids suddenly reports severe abdominal pain and tense distended abdomen. What should the nurse do first? A. Continue fluids to flush toxins. B. Stop fluids and assess for possible bowel ischemia or perforation. C. Reassure patient and give analgesics. D. Increase fluid speed to compensate. Answer. B. Stop fluids and assess for possible bowel ischemia or perforation. Rationale. Distension and pain may indicate complications, perforation, or overload. Fluids would worsen it. Analgesics without assessment mask deterioration. Question 8. In a cholera treatment center, which client should the nurse assign to the most experienced nurse? A. Adult with watery stools but stable vitals. B. Child with sunken eyes, weak pulse, and delayed refill. C. Pregnant woman with mild dehydration. D. Elderly man requesting ORS preparation instructions. Answer. B. Child with sunken eyes, weak pulse, and delayed refill. Rationale. The unstable child with signs of shock needs the most experienced nurse. Others are stable or can be delegated. Question 9. A nurse is evaluating a child with cholera. Despite aggressive ORS therapy, the child is lethargic, has thready pulse, and poor perfusion. What is the best next action? A. Continue ORS and monitor hourly. B. Switch immediately to IV Ringer's lactate bolus. C. Give antibiotics only. D. Stop fluids until stool frequency decreases. Answer. B. Switch immediately to IV Ringer's lactate bolus. Rationale. Failure of ORS with worsening signs means progression to severe dehydration requiring IV fluids. Continuing ORS is unsafe. Antibiotics alone don't fix shock. Stopping fluids is life-threatening. Question 10. During a cholera outbreak, which intervention provides the greatest population-level impact? A. Stockpiling IV fluids in hospitals. B. Mass distribution of oral rehydration solution and safe water education. C. Quarantining all suspected cases. D. Restricting all community gatherings. Answer. B. Mass distribution of oral rehydration solution and safe water education. Rationale. ORS distribution plus water safety saves most lives. IV stockpiling helps severe cases, but not population-wide. Quarantine, C, and restrictions, D, delay access to treatment. Question 11. A patient with cholera develops persistent vomiting and cannot tolerate ORS. Which management is most appropriate? A. Switch to IV fluids and administer antiemetic if ordered. B. Continue forcing ORS despite vomiting. C. Delay fluids until vomiting subsides naturally. D. Administer oral antibiotics only. Answer. A. Switch to IV fluids and administer antiemetic if ordered. Rationale. Persistent vomiting requires IV hydration and symptom control. Forcing ORS increases vomiting. Waiting risks hypovolemia. Antibiotics don't correct dehydration. Question 12. A patient with cholera is receiving IV fluids and antibiotics. Labs show potassium ion 2.8 milliequivalent per liter, sodium ion 138 milliequivalent per liter, hydrogen carbonate 16 milliequivalent per liter. What should the nurse do? A. Administer IV potassium chloride cautiously. B. Restrict potassium until diarrhea resolves. C. Add sodium bicarbonate infusion only. D. Stop fluids until potassium stabilizes. Answer. A. Administer IV potassium chloride cautiously. Rationale. Severe hypokalemia plus metabolic acidosis require potassium ion replacement with fluids. Restricting potassium ion worsens risks. Bicarbonate alone doesn't solve potassium loss. Stopping fluids is unsafe. Question 13. In a resource-limited outbreak zone, which ethical principle guides fair distribution of IV fluids? A. Give to those who can pay first. B. Prioritize patients with severe dehydration at greatest survival chance. C. Provide equally to all regardless of need. D. Reserve for healthcare workers only. Answer. B. Prioritize patients with severe dehydration at greatest survival chance. Rationale: justice and utility guide scarce resource allocation. Prioritize severe cases likely to survive with treatment. Options A, C, D are unethical or inefficient. Question 14. A cholera patient shows signs of hypovolemic shock. The provider orders 500 milliliters, 0.45% NS. What should the nurse do? A. Administer as ordered. B. Clarify the order because hypotonic fluids are inappropriate in shock. C. Switch to oral ORS immediately. D. Mix with glucose to increase absorption. Answer. B. Clarify the order because hypotonic fluids are inappropriate in shock. Rationale: hypotonic fluids worsen shock. Isotonic fluids are required. Administering risks deterioration. ORS is ineffective in severe dehydration. Glucose addition doesn't solve the issue. Question 15. A nurse teaches caregivers of a cholera patient about water safety. Which statement shows unsafe practice? A. I will boil water for 1 minute before using it. B. I will keep water in a closed, clean container. C. I will add chlorine solution as recommended. D. I will store boiled water uncovered to cool quickly. Answer D. I will store boiled water uncovered to cool quickly. Rationale: uncovered storage risks recontamination. Boiling, covering, and chlorination are safe. Question 16. Which finding suggests fluid therapy should be slowed in a child with cholera? A. Capillary refill improving. B. Respiratory crackles and periorbital edema. C. Heart rate decreasing toward normal. D. Increased urine output. Answer. B. Respiratory crackles and periorbital edema. Rationale: these indicate fluid overload. Improvement in perfusion, ACD, is expected and not a reason to slow fluids. Question 17. Which cholera patient requires immediate provider notification? A. Elderly adult with mild thirst and dry lips. B. Pregnant woman with tachycardia, confusion, and absent urine output. C. Child drinking ORS and playing. D. Young adult with one watery stool and normal vitals. Answer. B. Pregnant woman with tachycardia, confusion, and absent urine output. Rationale: severe dehydration plus pregnancy increases maternal or fetal risk and needs urgent escalation. Others are mild or stable cases. Question 18. A nurse is planning care for a community outbreak of cholera. Which action best prevents recurrent transmission after discharge? A. Teaching about correct ORS preparation only. B. Educating families on safe disposal of feces and hand washing. C. Prescribing antibiotics for all family members. D. Advising avoidance of crowded places. Answer. B. Educating families on safe disposal of feces and hand washing. Rationale: fecal, oral route prevention is key. ORS teaching alone treats dehydration, not transmission. Blanket antibiotics promote resistance. Avoiding crowds is irrelevant. Question 19. Which clinical change signals transition from moderate to severe dehydration in cholera? A. Increased thirst and irritability. B. Urine output drops to anuria. C. Dry mucosa and sunken eyes. D. Restlessness during rehydration. Answer. B. urine output drops to anuria. Rationale: anuria indicates severe intravascular depletion. A. Thirst or irritability, and C. Dry eyes or mucosa are moderate. Restlessness is nonspecific. Question 20. A child with cholera has received ORS but continues profuse stool losses. What is the best next step? A. Escalate to IV rehydration with Ringer's lactate. B. Stop ORS since it is not effective. C. Start broad-spectrum antibiotics alone. D. Restrict fluids until stool frequency decreases. Answer: A. Escalate to IV rehydration with Ringer's lactate. Rationale: ongoing high stool losses plus ORS failure, progression to severe dehydration needing IV resuscitation. Stopping ORS worsens dehydration. Antibiotics are adjunct, not primary. Restricting fluids is fatal. Question 21. A 40-year-old man with cholera has received 3 liters of Ringer's lactate. He is still hypotensive, heart rate 140, MAP 55. What should the nurse anticipate next? A. Initiate norepinephrine infusion. B. Administer another bolus of Ringer's lactate. C. Restrict fluids to prevent overload. D. Start oral rehydration therapy. Answer: A. Initiate norepinephrine infusion. Rationale: if shock persists after aggressive fluids, vasopressors may be required. Another bolus risks fluid overload if unresponsive. Restriction is unsafe. ORS is insufficient in shock. Question 22. A cholera patient on IV rehydration develops serum sodium ion 125 milliequivalent per liter with seizures. What is the most urgent nursing intervention? A. Administer hypertonic saline IV. B. Restrict fluids completely. C. Increase ORS administration. D. Stop all antibiotics. Answer: A. Administer hypertonic saline IV. Rationale: severe symptomatic hyponatremia requires hypertonic saline to prevent cerebral edema. Restricting fluids. B. Alone won't resolve seizures. ORS worsens dilution. Antibiotics don't treat hyponatremia. Question 23. A nurse receives orders for a child with cholera. IV 20 milliequivalent KCl in 1000 ml LR at 150 milliliters per hour. What must the nurse do first? A. Start infusion immediately. B. Confirm urine output before administering potassium. C. Add additional sodium bicarbonate. D. Delay potassium until diarrhea resolves. Answer: B. Confirm urine output before administering potassium. Rationale: potassium should not be infused without urine output due to hyperkalemia risk. Starting immediately may cause fatal arrhythmias. Sodium bicarbonate is not ordered. Delaying potassium ion ignores replacement needs. Question 24. During a cholera outbreak, a nurse is assigned 5 clients. Which client requires immediate intervention? A. Child with cap refill 3 seconds and urine output 10 milliliters per hour. B. Adult tolerating ORS with moist mucosa. C. Elderly man receiving antibiotics and stable vitals. D. Pregnant woman with mild dehydration. Answer: A. Child with cap refill 3 seconds and urine output 10 milliliters per hour. Rationale: delayed refill plus oliguria equals progressing shock, needs urgent fluids. Others are stable and lower priority. Question 25. A nurse is teaching caregivers how to prepare ORS. Which caregiver statement requires correction? A. I will measure the sugar and salt carefully before mixing. B. I will store prepared ORS in a covered container for up to 24 hours. C. If my child vomits, I will stop giving ORS completely. D. I will use safe, clean water for mixing. Answer C. If my child vomits, I will stop giving ORS completely. Rationale: ORS should still be given in small frequent sips despite vomiting. Others show correct understanding. Question 26. An adult with cholera has severe dehydration. The provider orders oral tetracycline. What should the nurse do? A. Administer tetracycline immediately before rehydration. B. Delay antibiotic until initial rehydration is achieved. C. Hold the drug permanently. D. Give with ORS to improve absorption. Answer. B. Delay antibiotic until initial rehydration is achieved. Rationale. Antibiotics are only effective once circulation is restored. Giving before rehydration delays urgent priority. Holding permanently misses benefit. Question 27. A cholera patient develops confusion, carpopedal spasms, and tingling fingers after rapid IV rehydration. Which electrolyte imbalance should the nurse suspect? A. Hypokalemia. B. Hypocalcemia. C. Hypernatremia. D. Hyperkalemia. Answer. B. Hypocalcemia. Rationale. Rapid volume shifts may cause hypocalcemia with neuromuscular irritability. Hypokalemia causes weakness. Hypernatremia causes CNS depression. Hyperkalemia causes arrhythmias. Question 28. A nurse managing a cholera isolation ward observes a nursing assistant leaving the room without hand washing. What is the most appropriate action? A. Document and report the breach immediately. B. Re-educate and require proper hand washing at that moment. C. Ignore since gloves were worn. D. Restrict assistant from further patient care. Answer. B. Re-educate and require proper hand washing at that moment. Rationale. Immediate correction prevents spread. Documentation or reporting can follow. Gloves alone are insufficient. Restricting is too punitive without re-education. Question 29. A child with cholera receives IV fluids but continues high stool output. The provider orders zinc supplementation. What is the nurse's priority teaching point? A. Zinc shortens diarrheal duration and improves immunity. B. Zinc prevents dehydration immediately. C. Zinc replaces lost sodium. D. Zinc eliminates Vibrio cholerae directly. Answer. A. Zinc shortens diarrheal duration and improves immunity. Rationale. Zinc is proven to reduce diarrhea duration and improve gut healing. It does not directly rehydrate or kill bacteria. Question 30. A patient with cholera has heart rate 126, BP 92/58, and is lethargic. After 2 liters of IV fluids, heart rate is 118, BP 94/60, still lethargic. What is the nurse's next priority? A. Increase IV fluids and reassess frequently. B. Switch to oral rehydration solution. C. Stop fluids and monitor. D. Discharge with education. Answer. A. Increase IV fluids and reassess frequently. Rationale. Incomplete response requires continued aggressive rehydration. ORS is not appropriate yet. Stopping or discharge is unsafe. Question 31. A nurse is preparing discharge teaching for a family after cholera treatment. Which measure ensures long-term prevention? A. Complete antibiotic course if prescribed. B. Continue safe water, sanitation, and hygiene practices at home. C. Restrict the child's diet to bland foods. D. Keep leftover ORS for months in storage. Answer. B. Continue safe water, sanitation, and hygiene practices at home. Rationale. Prevention depends on wash practices. Antibiotics don't prevent reinfection. Diet is not central. ORS spoils after 24 hours. Question 32. A nurse manages 3 patients with cholera. Who should be evaluated first? A. Adult with watery diarrhea and heart rate 100. B. Child with sunken eyes, delayed refill, and lethargy. C. Pregnant woman tolerating ORS. D. Elderly man with antibiotics ordered. Answer. B. Child with sunken eyes, delayed refill, and lethargy. Rationale. Severe dehydration with altered mental status is priority. Others are stable. Question 33. A cholera patient develops arrhythmias during IV therapy. Which electrolyte imbalance should the nurse assess for first? A. Hyperkalemia. B. Hypokalemia. C. Hyponatremia. D. Hypocalcemia. Answer: B. Hypokalemia. Rationale: severe diarrhea, potassium loss, arrhythmias. Other imbalances are less immediately arrhythmogenic here. Question 34. A community nurse prioritizes interventions during a cholera outbreak. Which should be implemented first to reduce deaths? A. Widespread antibiotic distribution. B. Rapid access to ORS and IV fluids. C. Vaccination of entire community. D. Long-term sanitation projects. Answer: B. Rapid access to ORS and IV fluids. Rationale: rehydration prevents most deaths. Vaccines and sanitation are important long-term. Antibiotics are adjuncts, not primary lifesavers. Question 35. A cholera patient receiving fluids suddenly has decreased breath sounds, hypotension, and jugular vein distension. What should the nurse suspect? A. Fluid overload. B. Pulmonary embolism. C. Tension pneumothorax. D. Cardiac tamponade. Answer: A. Fluid overload. Rationale: overhydration, pulmonary edema, JVD, hypotension. PE and tamponade are possible but less likely in context. Pneumothorax is not associated with IV fluids. Question 36. A patient with cholera refuses treatment due to cultural beliefs. Which nursing action is most appropriate? A. Document refusal and provide no further care. B. Engage cultural mediator or interpreter to explore concerns. C. Administer treatment without consent. D. Call law enforcement to enforce treatment. Answer: B. Engage cultural mediator or interpreter to explore concerns. Rationale: respect autonomy while addressing concerns through culturally sensitive dialogue. Forced care is unethical. Documentation alone neglects advocacy. Question 37. Which discharge instruction is critical for preventing relapse of dehydration in children recovering from cholera? A. Provide extra fluids after each diarrheal stool. B. Avoid all solid foods for 1 week. C. Stop breastfeeding until diarrhea stops. D. Use antibiotics whenever diarrhea returns. Answer: A. Provide extra fluids after each diarrheal stool. Rationale: extra ORS prevents dehydration recurrence. Solid foods and breastfeeding should continue. Antibiotics are not always indicated. Question 38. A cholera patient is receiving IV fluids. Which finding requires immediate intervention? A. Urine output increases to 50 milliliters per hour. B. Crackles auscultated at lung bases. C. BP increases from 80/40 to 100/60. D. Cap refill improves from 4 seconds to 2 seconds. Answer: B. Crackles auscultated at lung bases. Rationale: crackles indicate fluid overload requiring adjustment. Other findings show improvement. Question 39. Which patient scenario illustrates a failure in evidence-based practice for cholera? A. Using ORS for moderate dehydration. B. Giving hypotonic fluids to patient in hypovolemic shock. C. Administering zinc supplementation in children. D. Teaching families to boil water before use. Answer: B. Giving hypotonic fluids to patient in hypovolemic shock. Rationale: evidence-based care mandates isotonic solutions. ORS A, zinc C, and boiling water D are correct. Question 40. A cholera patient has received 5 liters of fluid. The nurse notes hand tremors, irritability, and cardiac ectopy. Which lab result is most consistent? A. Potassium ion 2.6 milliequivalent per liter. B. Sodium ion 140 milliequivalent per liter. C. Calcium ion 9.0 milligrams per deciliter. D. Chloride ion 100 milliequivalent per liter. Answer. A. Potassium ion 2.6 milliequivalent per liter. Rationale. Hypokalemia causes tremors, irritability, and arrhythmias in cholera due to stool losses. Other values are normal. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.